This woman already had 7 children, but she was still not satisfied. She ignored her serious heart condition and took the risk of having another baby. The hospital soon asked her to come for a checkup, but during her last pregnancy, the doctor had already warned her that being pregnant again could put her life in danger. Because of this, Annette was very afraid that she would be scolded if she went to the hospital. Seeing her so worried, her husband decided not to let her go for checkups anymore. But soon, Annette's body started to show problems. She suddenly fainted on the street, but luckily a kind man caught her, and a nearby shop owner brought a chair so she could rest. When they noticed her baby bump, they quickly informed the hospital. Annette was soon admitted to the hospital. The doctor once again gave her a serious warning. She had rheumatic heart disease, and being pregnant could put her life in danger. But Annette had no choice. Her husband loved children very much, so she could only take the risk of giving birth again. The doctor had to talk to her husband and said that if Annette wanted to live, she could not get pregnant again. Meanwhile, Annette suddenly felt dizzy in bed. The nurse held her hand to check her pulse, and her heart rate reached 180 beats per minute, which was clearly abnormal. The doctor worried that something dangerous might happen, so he decided to break her water immediately, induce contractions, and then use forceps or a suction device to help with delivery. This way, the baby could come out quickly, and Annette's life could be protected. As her contractions grew stronger, Annette was taken into the operating room, and her limbs were fixed. Although her lower body was anesthetized, she was still very scared. When she saw the suction device, her face turned pale with fear. Halfway through labor, she could not continue. The cold touch of the instruments made her feel extremely uncomfortable. But at this critical moment, the doctor had already placed the suction device on the baby and was slowly pulling the baby out. Although it was painful, Annette could only hold on and continue with the delivery. With everyone's effort, the baby was finally born safely. Annette looked at the crying baby and smiled with great joy. Annette was immediately sent to the intensive care ward for observation. The nurse worried she would feel lonely, so she brought the baby over and also allowed her husband to visit. Looking at Annette's tired face, her husband felt very guilty and heartbroken. He finally promised Annette that he would not let her have more children again.